A 65-year-old man has the above histology for a suspected malignancy. Which of the following is the most likely cell of origin? Choice A, tubular. Choice B, pulmonary neuroendocrine. Choice C, astrocyte. Choice D, osteoblast. Or choice E, transitional. And we have this histology slide showing a bunch of cells which appear to be white in color. Anyway, I'll wait 5 seconds and answer the question. So it might seem like I withheld a lot of information for this question, but that is deliberate, because this is one of the few histology slides you should be able to see and instantly recognize. This is RCC. This is renal cell carcinoma, aka clear cell carcinoma, aka renal adenocarcinoma. They could write any of those on the USMLE. They could just write adenocarcinoma if they feel like being jerks. RCC originates from the proximal renal tubular epithelium, so choice A, tubular, is the correct answer. I mean, RCC, quite a bit we can talk about. Smoking is the most significant risk factor. Oftentimes when it presents in a question, it'll just be painless hematuria. And if they're nice, they'll tell you that they found a mass on a kidney. It's associated with some systemic illnesses, von Hippel-Lindau, tuberous sclerosis. Paraneoplastic syndromes is another thing they really like testing. You could have ectopic EPO secretion, and obviously that can lead to polycythemia. It can secrete PTH-RP, which will lead to a PTH-like effect, right? You'll have a hypercalcemia, hypophosphatemia, and hypervitaminosis D. And in opposition to some kind of tumor that secretes PTH, since this is PTH-RP, PTH will be down. The other tumor that is well known for PTH-RP is squamous cell carcinoma of the lung. RCC can also have paraneoplastic syndromes involving ACTH and prolactin, I believe, but I don't think they've ever really tested on those. They like to focus on either EPO or PTH-RP. Those are the favorites for paraneoplastic syndromes. So looking real quick at these other answer choices, choice B, pulmonary neuroendocrine. This is an origin for several different lung cancers, including small cell lung cancer. Choice C, astrocytes. Astrocytes can become astrocytomas, of course, and of course the most severe astrocytoma is a grade 4, which is glioblastoma multiforme. Crosses the midline, looks like a butterfly. It's called butterfly glioma. It's GFAP positive because astrocytes are GFAP positives, and it's just a very severe brain cancer. Choice D, osteoblast, which once again, this can form all kinds of different tumors, including osteosarcoma. I mean, osteosarcoma, I guess you can think about the sunburst appearance on X-ray, associated with teens. Retinoblastoma can also be in the elderly if they have Paget disease of bone. Choice E, transitional. Transitional cells can become urothelial carcinoma in various places along the urinary tract, so bladder cancer, cancer of the ureter. Technically, the renal pelvis probably also is transitional cell carcinoma, but I don't think I've ever seen that. I mean, we could sit around and talk about every single one of these answer choices for like half an hour, right? Because there's so much we could talk about, but I want to keep this focused, which is pretty much that you should recognize what RCC looks like. It's a very distinct histology slide. And yes, you need to know it's from renal tubular epithelium. I hope you found this video helpful. I'll see you in the next one.